And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Well, good morning and welcome to Boomer Life here on CIL 650. This morning we're joined by one of the professional medical team at False Creek Healthcare Center. Today focusing on your health. In studio with us from False Creek Healthcare Center in Vancouver. The address, by the way, is 555 West 8th Avenue right downtown. Urologist Dr. William Taylor is with us this morning. Good morning, Dr. Taylor.
Morning, Sterling. It's my pleasure to be here.
Your expertise is urology. Tell us about urology, Dr. Taylor. What exactly is that field? We know the word, but what it is involved? What areas do you specialize in?
Urology is a very broad specialty. It involves kidneys, bladder, kidney stones, kidney tumors, enlargement of the prostate, cancer of the prostate, leakage of urine in men and women, problems with infertility, vasectomy reversals, and pediatric urology as well, amongst some of the things we do.
Right. And you're, in addition to being a urologist at False Creek Healthcare Center, Dr. Taylor, you were chief of surgery at Richmond General Hospital for a number of years.
I was, and a couple of years ago I stepped down from Richmond Hospital, felt I'd like to spend a little more time not being on call,
right.
And wanted to do still some private consultations and a small amount of surgery as well, which I do at False Creek Healthcare Center.
Okay, so you're a member of the surgical team. How many people at False Creek Healthcare Center?
There are more than 110 physicians and surgeons that work at False Creek, and they cover multiple disciplines, including orthopedics, urology, neurosurgery, ear, nose, and throat, gastroenterology. We do executive healthcare examinations. We also have a lot of very high-quality imaging. We have a 3 Tesla MRI scanner, which is the best in the province, and we have an excellent radiology team. These are just some of the areas that we cover.
Not much accent left, but it's South African, isn't it?
That's right. I'm originally from Johannesburg.
All right. And how long have you been in Canada, sir?
Since 1976.
Okay. And did you come right to British Columbia?
No, I trained in Toronto. I spent 3 years in Toronto, and then did a postgraduate fellowship in North Carolina for 2 years, and then came back to Vancouver.
All right. Interesting. Well, now you are, you mentioned over 110 doctors on staff. In the urological department at False Creek Healthcare Center, there are, what, 10 of you?
We have 10 of us. We have 3 women who deal a large amount with female urological problems. One of them also deals with all the pediatric patients we encounter. And then the other men, and we each have special areas of expertise.
Okay, and so of that area, which would your focus or area of expertise be?
Initially, I came down to False Creek to do the microscopic vasectomy reversals, which were no longer available in the public system. And since then, have been doing a lot of work with enlargement of the prostate and consultations with cancer of the prostate, men's health issues, and some incontinence.
Well, it's very timely to have you in studio halfway through the month of Movember, Dr. Taylor, because it's all about men's cancer and men's health issues and prostate issues. So it's very timely that you're with us this morning, and we'll obviously return to a good discussion about men's health issues. We are notoriously reluctant to talk about these things, let alone sit down with an actual doctor once a year or more. So are we still as stubborn as all get out? Are guys still just impossible or darn near it when it comes to their own health?
Unfortunately so. Men are in fact a bit of an endangered species. They don't see the doctor as often as they should. They are diagnosed with cancer later than women are. They don't live as long as women. They don't get into university as much as they used to in the past. They have more mental problems. And all in all, men need a little more help than they're getting at this time.
Right. Well, hopefully you and I can provide a little bit over the next hour here on Boomer Life. Tell us about False Creek Healthcare Center. Got started up back in 1996. And when did you come on board?
About 2000.
Okay.
And initially, as I said, I started doing a lot of the vasectomy reversals for infertility, and then started to do other urological procedures.
I noticed doing a little homework for this conversation that in addition to False Creek Healthcare Center, you also refer to yourself as a Centric Health Surgical Center. What does that mean?
Centric is a big medical corporation that has expertise in running small clinics. And they have multiple clinics throughout the country. They also have multiple physiotherapy clinics. They run some pharmacies and generally do a good job because they know the business well.
So what if I turn into a patient at False Creek Healthcare Center? What should I expect? What's unique or different or particularly wonderful about False Creek Healthcare Center? What do you do differently or strive to do differently?
If you just look at the accreditation of the private clinics, is the college accredits them and expects them to meet or exceed the standards for public hospitals. So what we offer is excellence in surgical procedures, medical care, and we offer choice. We offer timeliness for patients to come and see a physician when they want to and not have to wait.
Right. And so tell us about the 110 plus medical practitioners under that one roof at False Creek Healthcare Center. You've described some of the areas of medical practice that these people are involved in. I suppose, though, having all of those people under one roof could be a tremendous advantage for a patient, particularly with more than one issue.
That's right. It provides an integrated system. If I need a general surgeon to see a urology patient who has a hernia, I just pick up the phone and that can be done. The imaging we have with our scanners, CT scanners, MRI scanners, and ultrasound can be done almost immediately. I pick up the phone and speak to the radiologist, and it's arranged right away. No wait.
Okay, and I suppose that in terms of, again, looking for efficient use of time, the fact that you're able to have the testing processes, the scans, et cetera, done ever so quickly really is just to everyone's advantage, isn't it?
It certainly is, particularly if there's a potential cancer involved, and then time is of the essence.
Do people come to False Creek Healthcare Center usually, Dr. Taylor, with urgent issues? Or shall we say, I don't know how I'm trying to find the right, personal issues. When I'm trying to separate urgent from, well, just say non-urgent. How about that?
Unfortunately, we're seeing more patients with some semi-urgent conditions. For example, in urology, I'll see patients who have a catheter in and have been told they have to wait several months for an operation on their prostate. They cannot work in this period of time. The catheter is uncomfortable, and they feel they just need to get things fixed right away.
Right, and you're able to provide that rapid remedy.
Most times we are, and if we're not, we can always refer the patients to the public system when appropriate.
Okay, now you're talking about these more urgent. There seems to be an elevation in the degree of urgency that a lot of people are presenting when they show up at False Creek Healthcare Center. Are these cancer patients we're talking about, Dr. Taylor?
Some of them. Some patients just need another opinion, an unbiased opinion, as to, for example, what their prostate cancer is. Does it need surgery? Does it need radiation? Does it need any treatment at all? So we get a lot of patients who come for another opinion.
Right. Is that still recommended? I mean, it used to be back in the day. It was always, well, get a second opinion if you're having any doubts. Get a second opinion. Is that still a front and center type recommendation?
It's the patient's absolute right to get a second opinion from any physician they wish to consult at any time.
Right. And are more and more of us exercising that right?
I think so. I think with the internet, patients are now very well informed, and they've read about different ways of treating a certain condition. And sometimes they want to hear from somebody else which way they should go.
Interesting. Now, I suppose the dangerous side of that is, because we Canadians are real fans of the internet. We use it a lot. Have you encountered from time to time someone who's, well, all self-diagnosed? Because, I looked it up on the internet, Doc, and I've got this. And they come and they're absolutely convinced they have a condition because it said so on the internet, and they don't have it at all.
Mostly you can discuss this with the patient and talk them out of it. They do understand that you can read between the lines and that expertise does count for something, even in their profession.
Right.
So they will usually come around to what you're saying.
Being a little facetious there, I wanted to ask you, you're a urologist, and this was a news story just last week. And we're talking about prostate cancer. Here we are midway through the month of November, or Movember, if you're moved in that direction. But there was a news story last week about the PSA test. There was a study group that had gone to some great lengths and came out with a headline story last week, or a week or two ago now, saying the PSA test may not be necessary, and caused quite the controversy. So, two questions here for you, Dr. Taylor. First, what is a PSA test? And was that story with those, was the group that was recommending maybe not paying so much attention to it, were they on the ball with that recommendation? What were your thoughts on that story?
Okay. PSA is a substance secreted by the prostate gland.
Okay.
Sometimes when the PSA is increasing, it may suggest that there is cancer of the prostate. This doesn't hold all the time. It doesn't also tell us how active the cancer is and whether or not it needs to be treated. But it's the best test we have at the present time.
All right.
It may be replaced at a later date by something more specific.
This is the test, sorry to interrupt, but this is the test that men over the age of 50 are recommended to have once a year. Is this the same one?
That has been the previous recommendation.
Okay.
Now, to answer your second question, the Canadian and the U.S. task forces on preventative care have both come out in advising against the PSA as a screening test. Now, this needs a little clarification.
I'm glad you're here to do that for us.
Screening means checking every man, even if he has no symptoms or no problems, for cancer. The task force says that patients over the age of 55 may possibly benefit from the test, whereas under 55 probably shouldn't have this test at all.
Okay.
The reason being is if you find a cancer in the prostate, it may cause harm to patients if they are treated. And the treatment is either surgery, radiation, and sometimes hormonal therapy. What are these complications? They are sometimes devastating. Urinary incontinence, which means leakage of urine, and erectile dysfunction. Now, with the surgery, we have improved the surgery significantly, and incontinence has become a lot less, as well as erectile dysfunction, but it still is present. So what are the numbers? The numbers are at present about 1 in 8 men will get cancer of the prostate, but only 2 or 3% of men will actually die of cancer of the prostate. Most men in their 90s will have cancer of the prostate. And all men are now living longer. In the 1930s, the average man used to live to 64.
Right, yes.
And he used to retire.
And where are we now in 2014? What's
the
our
average
typical
man in Canada is about 78.
Yeah, yeah.
But there are a lot of healthy men well into the 80s and 90s.
Definitely.
And they're very active. So this has changed what we're seeing a lot.
So am I misreading the information you're passing? Do all guys get prostate cancer and it just adversely affects a very small percentage of us?
That's correct. So the bottom line...
I did not know that.
The bottom line is, what kind of cancer do you have? And we have ways of grading it and staging it. And the high-grade cancers will cause an early death. They will spread to the bone and cause a lot of problem. If these patients can be treated early, lives will be saved.
Right.
And it is the onus of the physician to be somewhat aware of these recommendations of the task forces. And I think we are becoming better at defining which cancers need to be treated and which cancers we can watch and wait. So I think there's a balance here that hasn't quite reached the task forces. I think it's too draconian to say nobody should be tested.
Right.
And I think their recommendation for you to go back to your family physician and discuss it with them is somewhat of a cop-out, because the family physicians, although they are very good, haven't got all that knowledge to be able to advise your patient very well.
Right. Okay. So would you stick to the old standard then that most guys 50 years plus should have a PSA test once a year? At least that gets us thinking along some kind of personal health lines, doesn't it?
I would recommend that. I have a PSA test on an annual basis. I think if the PSA rises, a biopsy should be considered. And then the interpretation of that biopsy is very crucial as to the further management. Unfortunately, once you tell patients they have a cancer, they don't hear anything else.
Oh, no. That's pretty devastating information, isn't it?
They equate that with a premature death, which
Sure.
is not always going to happen.
Right.
So most of our patients, if you spend time with it, you can educate them and discuss this with them. They will understand the rationale for being conservative.
Need to take a break here, but I expect it to be pretty easy to get a PSA test done at the False Creek Healthcare Center.
Tomorrow.
Our guest from the False Creek Healthcare Center, which is downtown at 555 West 8th Avenue here in Vancouver, is urologist Dr. William Taylor. This is Boomer Life on CL 650 with lots more still ahead this Saturday morning. Stay with us. We'll be right back.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.